get into this conversation now. The Health Department says it is still investigating the severity of the new COVID-19 strain. The XBB 1.5 variant has been identified as the most transmissible. Now, the World Health Organization says the variant has been identified in 28 other countries. Joining us now for this conversation is Dr. Lesley Bamford, the vaccination team leader at the National Health Department. Doctor, thank you very much for your time. To the viewers listening and perhaps worried at this time, especially with the transmissibility of this new variant, how worried should they be?
Good morning, and good morning to the viewers. So our current view is that there certainly is no need to panic. We are concerned, and we need to increase our surveillance and watch very carefully. As you indicated, a case of the new subvariant has been identified in South Africa. We are still waiting for all the details to announce that officially. There is evidence from around the world that the subvariant may be more transmissible, but currently there is nothing to suggest that disease caused by the subvariant is more severe than the disease caused by other subvariants, subvariants of the Omicron variant.
All right. So let me quickly ask then as to what symptoms have been observed, or is that still under investigation? Once you get this this COVID variant in your body, how does it act? What kind of symptoms does a person experience?
So our current understanding is that the symptoms would be much the same as with other variants or other subvariants of the Omicron variant. So sometimes quite non-specific symptoms, some fever, some tiredness, sore throat, cough, respiratory symptoms. So from a disease perspective, we would not currently expect any difference. You know, I think we want to send out a clear message. There seems to be a perception that COVID is over, whereas that is not the situation. We know that the numbers are low, but people continue to be infected with COVID, to become ill, low numbers, but still people being hospitalized, and still some deaths from COVID. At this stage, we do not expect that this subvariant will result in any dramatic changes, but we need to watch that very carefully. And our advice to the public remains the same. Vaccination is the best protection against COVID infection, particularly against severe COVID disease. So we know that many vaccination sites across the country have closed because of low demand for vaccination. So we will be putting our efforts into ensuring that vaccination remains accessible, and continue to encourage people to come forward to be vaccinated and to take the other precautions to avoid crowded places, to wear a mask if they feel comfortable doing so.
Dr. Lesley Bamford, let's leave that conversation there. Thanks indeed for your time.